Okay, so we're going to have a quick look at some basic anatomy of the elbow joint so that we can appreciate what we're testing when we move on to special tests. So this is just an overview of where the hinge joint lies, what other joints and articulations occur there, and what these movements are. So if we start by just indicating some of the movements, we have flexion and extension in the elbow joint, and most of that occurs around this side, which we'll have a closer look at in a moment. The other more complex movement that we have to look at is pronation and supination of the forearm. So that's pronation and supination. And you will see that this movement here comes from the head of the radius to actually allow that bone to rotate, and you will also see that the radius always tracks with the thumb side no matter where the thumb goes, so the forearm bones actually cross as we pronate our forearm. So when we're massaging, it's always right and proper to keep the anatomical position, in other words a supinated forearm, so that the bones lie side by side, and as we're working on those muscles, then that makes it a lot easier to massage. If we take a closer look at the joints themselves within this region here, some important bony prominences first of all are these two wide prominences here, which are your medial on this side and your lateral epicondyle. So with your lateral epicondyle you have your forearm extensors or your wrist extensors. This is the common origin and the site where a tendonitis problem is going to occur. A medial aspect here is the golfer's elbow, and this is where your wrist flexors commonly originate from, and this is where it's likely to become painful. This area here, where the proximal end of the ulna articulates with this part of the humerus, is known as the trochlea. This rounded surface here is the capitulum, and this is the head of the radius. And this articulation also not only articulates between radius and humerus, but with the ulna next to it, and we would have a ligament called an annular ligament that straps around just below the head of the radius and allows that rotational movement to occur and holds the head of humerus in place. So we've got three major articulations there.